Hello, I'm Dr. Hamblin here at the Center of Dental Professionals, and today I'm going to talk about what your options are if you have a toothache. Because here in our office, a lot of people come in and they have a tooth hurting, so we take a picture and see what the options are. And basically, when there's a bad toothache and you're in a lot of pain, there's two main options. Either pull the tooth or do the root canal therapy that would be needed. And when you think about those two options, you have to decide which one's best for you. And a lot of times people decide that, oh, I just want the tooth pulled, don't fix it for me. And sometimes that's the best option and sometimes it's not. And the reason why it's not the best option is because later on, after you're missing that tooth, it costs a lot more to replace it with either a bridge or an implant. It becomes very expensive, and it is not a good thing sometimes to pull the tooth. Even though you might think it's less money, and right at this point it's what you want to do, but it's actually better to save that tooth if possible. So what we have to do to save the tooth is do a root canal therapy. And the reason being is because if the tooth is hurting, usually the decay or the tooth is traumatized and the root dies. And so when it dies, you have deep decay a lot of the times. And to clean that decay out is the first part of the treatment. And then we go into the canals and clean those areas out. So you have the pulp chamber, and then you have the canals that we all clean out. And as we clean that out, that's called the root canal therapy. And usually we numb you up so there's no pain involved with that. It's maybe a 45-minute to an hour visit, depending on which tooth. And when you leave, there's a lot less pain. And normally I tell my patients that in 2 days that tooth has stopped hurting, which is great because they come in with a lot of pain. And in 2 days, the tooth has stopped hurting. Once we finish the root canal, we like to crown the tooth. If we crown that tooth, that keeps it a solid tooth that you can have for the rest of your life. If we pull the tooth, we cause a lot of problems down the road. So here at the Center of Dental Professionals, we try to let you know what your options are, and we'd be more than happy to do whatever you want us to do, but saving the tooth is what we recommend. And root canal therapy is not as difficult as you think, and if it's done right and the tooth is fine forever, it becomes still a healthy tooth that stays and you can chew on for the rest of your life. So we love to help our patients out, get them out of pain, and we recommend most of the time to do that root canal treatment. So if you come and visit us, we'll be more than happy to talk to you about the options and to get you out of pain.